individual that's been a close contact to somebody who has the COVID-19, and also starting to see community transmission, meaning we can't identify how that individual acquired the virus. So I can't stress enough the importance of us abiding by our health officer orders with respect to sheltering in place. I know that it's very challenging. We're a very social community, but we really need to heed to those orders, because that is how we are going to be able to kind of contain and control how far the disease, the virus spreads. So we're going to continue to provide messages to the community to try to encourage that. Our law enforcement officials have been really responsive in terms of educating our public and our businesses about, you know, closing down shop if they're not identified as an essential service in our local health officer order, as well as with the guidance that's been provided by the state. I just want to continue to stress that we need to kind of stay in our home, stay with our nuclear family or whoever we live with, and only go out for those things that are necessary. While we're there, we want to make sure that we continue to abide by practices that we could implement to try to prevent the spread of not only COVID-19, but also other viruses, you know, making sure we're washing our hands regularly for at least 20 seconds, avoid touching our face. I know that is something really hard to not do. So really training ourselves to not touch our hands with our faces with dirty hands, making sure that we're constantly disinfecting and cleaning surfaces that are normally touched, and really staying away from people who are sick. The social distancing does require that we maintain at least a 6-foot distance between ourselves and somebody else, whether they're sick or not. As you might be aware, COVID-19 is a droplet at this juncture, meaning that it's not a fine mist that stays in the air for a long period of time, but can sit on surfaces, which is why it's important for us to disinfect surfaces and wash our hands frequently. If somebody from the public does get sick, you know, they start to experience a cough or they have a fever, we encourage you to call your primary care doctor first before you present at their clinic. And please, let's not utilize the emergency department. Let's reserve the capacity there for addressing true emergencies. So please, if you start to feel sick, stay home, don't go to work, don't go out, and call your physician to see if you need to come in for an appointment. And I see that Wendy's really good about, she has all our websites familiarized. In addition to calling 211, you can also now call the health department. It was on the first page that all the contacts there. You can call 755-4521 or 769-8700. That'll get you to a live person that can answer basic questions regarding COVID-19, who can get tested, where to go get tested, what to do if you're sick, and also be able to answer some questions with respect to our health officer order. So again, I encourage us to abide by the order, ensure that we're adhering to social distancing guidelines. You know, for the most part, most people will develop mild symptoms, but really we need to be safeguarding our elderly in our community, our parents, our grandparents, because unfortunately individuals over the age of 65 or those individuals that have chronic conditions like heart disease, diabetes, etc., will be the ones that will not just get a mild symptom from being exposed to COVID-19. They are individuals that are at much higher risk of developing serious illness related to being exposed to COVID-19. So happy to answer any questions at the end if I'm still on. If not, happy to answer them back to Wendy and then back to the community. Thank you.
Thank you so much, Elsa. Really appreciate all of the work that you've been doing and the great amount of information that is available on the website, and also the hotline available so that people can call and get answers to more specific questions. So with that, let's hear from Gerry Malais and the Office of Emergency Services. If Gerry is here, or Kelsey, Scanlin, if you're here.
Gerry and Kelsey both need to unmute. Hi, I think Gary's on the phone. Gary, you might be on mute, but I can start. My name is Kelsey Scanlin. I'm an emergency services planner with the Monterey County Office of Emergency Services. I am actually here in the Emergency Operations Center. I figured I'd give everybody a peek of what it looks like. We have the big board and all these super empty chairs, which is a little discouraging, but that's because they're practicing social distancing and everybody's working remotely. When we do have people in here, they sit 6 feet apart. Normally during any other type of disaster, this place can get as crowded as like 70 to 80 people. But this has kind of challenged all of our norms in terms of operating. So we've had to adjust a little bit. The Emergency Operations Center, also known as an EOC, is a either physical or virtual place where we coordinate the overall response to any type of incident, whether it be small or large, a pandemic or a wildfire or a man-made incident. It could be really anything. So all of our plans and all of our staff are trained to respond in an all hazards, whole community aspect, which means that we serve and respond to the needs of everyone in the community, not just the majority. And we really try to tailor our operations to that effect as well. Charles had mentioned earlier that we started at a level 3 activation, which is our lowest level, and then escalated to a level 2, which basically means that we increase staffing to have a more robust response as the incident escalates. You wouldn't necessarily start with a full activation of people for a small incident. So as it has progressed and there have been more tests and more cases, our response, as well as the health department's response, has increased in conjunction with each other and with the changing scenario, which truly does change daily. I know that Lori and Wendy have been posting a lot of information, but the daily situation report that we put out is super useful. It gives you a very high-level overview of all the things that we monitor and are responding to. You can also receive daily text messages through our alert and warning system. You just text MC COVID-19 to 888-777, and you can get the most up-to-date information in either of those two formats. I will defer to Gerry now. I don't know if Gerry wants to say something, but I'll let him do his thing if he does.
All right, Gerry, are you there? Can you unmute?
He's there, but his audio is not working, Supervisor.
Okay, great. Thanks, Nick, for playing go-between. All right, so that then is our kind of scheduled updates. I don't know, Nick, do you want to add something, or anyone else in the group want to add something that you think is important that might not have been said yet?
Well, I think the only thing I would add at this point, I think everything Charles and Kelsey covered was a good snapshot. We're working, looking at a plan to address homeless community issues, and we're working in conjunction with our Department of Social Services, and we'll be touching base with the cities as we work through that plan. But that's a priority of ours as well. So.
I might add, if I may, this is Eric Johnson. With Community Homeless Solutions, we've gone to 24/7 on the warming shelter. So we've got 70 people, more or less, currently housed there. We're limiting access in and out. We are also opening up a Chinatown shelter, hopefully by end of week, for about 15 folks. We're doing all the screening and staffing and so on for that right now. But that'll create some extra space there. We've got formal procedures in place for tracking and so on. In fact, Elsa, I sent you a little text to say if we have someone that presents with symptoms, are you the one to call first if we need some testing and so on? So maybe you can let us know about that as well, as opposed to calling the hospitals directly. And then Gary Gray has been very helpful. He's getting some thermometers and some a few masks and so on for us. One thing I put on the website too, we're Love Our Central Coast. We put the opportunity for volunteers and needs to kind of be posted on site there for people who want to do that. That's about 25, 30 churches throughout the community that are willing to step up and help. So if we can be of help there, one of the things we've talked about, which if you guys concur, is having 2 or 3 drop sites at churches where people can drop off extra gloves, masks, anything they have that might help the healthcare system with some of the shortages they have. So if that sounds like a good idea, Gerry thought that would be terrific, but I just want to make sure that's something too, Elsa, that would help you guys. We'll be happy to work with 2 or 3 church sites to distribute that. So that's where we are on homeless services right now.
Real quickly, we have activated the donations and volunteer unit in the EOC. So if that's something that executive leadership wants to do, we can move forward with connecting you to that unit in the EOC.
Thank you. There's a question in the chat asking about whether there's concern about having sufficient testing capacity. And maybe Elsa, you can speak to that.
Sure. So our, sorry, let me turn on my camera while I talk. Our public health lab was, I think there are 22 labs across California that are able to conduct tests locally. Our lab is one of those. We received our initial kit from the Centers for Disease Control and Prevention, which would have allowed us to test up to 300 individuals. There's been some changes in guidelines with respect to the materials that could be utilized for those test kits, so which actually doubled our capacity to date. We've tested, as of March 21st, about 270 individuals. So we still have a little bit more than half of that original supply that we received. Additionally, concurrently, we ordered a separate kit where we would be able to develop our own tests locally in our own lab and validate it and then submit to CDC for approval for implementing it. We are in the process of finalizing our validation and paperwork and expect to be able to begin to use that kit, which would provide the ability to be able to test another 700 individuals and hopefully in the coming week or 2. The one limiting factor for all laboratories is the availability of the reagents needed to be able to run the samples. The suppliers are estimating that the reagents will be available in the next 2 to 3 weeks. But in the meantime, our local health lab has requested from the state laboratory if they could send us some of the reagents that we need to kind of hold us over between what we have available now and when the supplier is able to fill all the orders for reagents. So at this point, there isn't mass testing that is being implemented. We are really following the Centers for Disease Control and Prevention guidelines with respect to who should be tested. So hospitals will call our public health communicable disease unit, present the case, and then depending on the individual circumstances, may authorize the sampling to be taken and the samples to come to our public health laboratory for testing, or the provider may also choose to, even if we deny it, be able to sample and then send it to one of our commercial labs. Our commercial labs are also geared up and ready to be testing samples for COVID-19. Those, the volume in terms of the number of tests that are sent to commercial is not something that's made available to our local public health lab. We would only interact with commercial labs if and when they had a positive result. So, I mean, at this juncture, we think we have sufficient to be able to kind of cover our day-to-day needs based on the current volume. In addition, we are also increasing our staffing in the lab. We're going to be bringing on graduate students that are able to run the PCR machines to be able to hopefully do 3 runs per day, 2 to 3 runs per day, which then will increase our capacity. Currently, we're able to process about 40 samples or 40 individuals per day. And so by bringing on these graduate students, we'll be able to increase our capacity. So we're just, you know, keep pushing onto the state to hopefully send us some reagents before we we run out and haven't received our supply order.
Thank you, Elsa. Well, we've got you 2 more questions. One that was asked before by Eric Johnson about if people have supplies that they would like to donate, is there a central place for that? Or yeah, so there seems
you're talking about like personal protective equipment. Is that what you're talking about?
Yeah, masks.
Like masks. So I would say that
gloves, everything.
Oh, gloves, yes. All of our requests for materials are running through our emergency operations center. So I would say that we should contact Kelsey. I'm not sure who in the shop would be, or if we can send you an email, but that's who we would contact with, because all of the departments and even community-based organizations requests for materials are running through the EOC and then through our MOAC.
Great, thank you. Because people do want to be as helpful as possible. And I think, Kelsey, you may have, you spoke to this, I think, when you talked about the volunteer crew or something, but if you could just say again, or if there's a single point of contact or a way that people can alert someone if they have a source for these supplies.
Yeah, so you can email us at info.oes@co.monterey.ca.us. I'll put it on the website as well. We're currently still in the process of standing up our ability to take in donations and volunteers. It takes a surprising amount of infrastructure. We call donations and volunteers actually the secondary disaster, because if you don't manage it from the start, it becomes very overwhelming and hard to catch up. So before we allow people to do that, we're really trying to make sure that infrastructure is in place. Hopefully it'll be up within the next couple of days. We have the staff available. Now we just have to kind of implement the plan.
Thank you, Kelsey. And Lori or Wendy, did you get that website address so we can put it up or have that in our list of?
I'll be sure to add it in the daily situation report as well.
Oh, great. Thank you, Kelsey. And then the other question for you, Elsa, is there's a question about whether there are whether there's some information about the person who has died from the virus and maybe future deaths. Is there a way to provide some degree of information that might be helpful to people to understand the risks and the potential transmission? And I guess the question is there anything useful that could be put out there other than what we already know, that if you have a compromised immune system, you're at high risk, or a certain age group, or?
I mean, I think that's the message we want to keep pushing, is that there are certain individuals within our community that are at a higher risk of developing more severe complications from contracting COVID-19. So it's really critical that everybody adheres to our shelter in place, stay at home order, and really ensures that there's social distancing happening when you're out securing your essential services, when you're going and picking up dinner to take home, or you're out in the grocery store or in the pharmacy. That is really the messages. Those are the messages that we want to make sure our residents are internalizing and adhering to the order.
Great, thank you. And then the question came up earlier about whether there's any value in showing any kind of hotspots map or some way of determining, locations in general where there might be more risk, or is that the work that you all do through your investigations?
I think at a point where we are concerned about the actual establishment of a hotspot, meaning in a specific community or in a geographic area or with a specific population, there probably will be more focus in pushing out messages to try to prevent the spread within that. At this juncture, we don't see that forming in our county yet, which is why we continue to just stress the importance of sheltering in place and abiding by the social distancing. I know many of us still have to go to work, hence I'm still at work. A lot of my staff at the health department are still at work, but we are, you know, implementing services with our patients telephonically, video conferencing, et cetera, to try to assure that our services are still available to our residents, but we're really adhering to social distancing guidelines.
Thank you. And I know for members of the community who aren't aware, when there is someone who is positively identified as someone who has the coronavirus, there is an investigation that the public health department does working with that patient to identify the people that they have come into contact with in recent times. So if you are someone who has come into contact with someone who has tested positive, you should be contacted by the public health department. So that's a process that is underway.
Thank you. Thank you for stressing that.
Jane, can I just confirm if we have anyone in our homeless shelters that show up with positive symptoms, should we call you, Elsa, and report that, and then you'll do the testing if we need it?
Well, actually, if somebody is positive with COVID-19 in your shelter, we'll be reaching out to you to let you know that. You may not know that.
No, I mean, but if we present with
if somebody is symptomatic,
right.
You asked that question earlier. You know, if somebody has a fever over 100.5, if they're coughing, if they're having trouble breathing, I mean, we encourage them to call their primary care doctor. And if they don't have a primary care doctor, I understand that 211 is making referrals to primary care physicians so that they can have that consult. And then the physician will make a determination as to whether they need to come in for an appointment. And a lot of our clinics are now seeing patients who are experiencing respiratory illnesses outside of their clinic setting. They're setting up, you know, alternative care sites outside of their clinics, similarly to the way hospitals are doing it for triaging. And if not, and if the physician is really concerned about that individual, then they will direct them to go to the emergency department for screening and testing if necessary.
Thank you. So we're not coming to you directly.
No, we are not. Our main health department building here is not a place to come in for screening or testing. We really want individuals to go back to their primary care provider.
Thank you.
And I think, yes, and I think Community Hospital has offered free e-consults. So that's another resource that's out there, but it may be just simpler to go through 211 and have them make the referral. Just, you know, several options out there. And on the, let's see, so a question has arisen about property tax and whether there is a deferral of property tax payments in the works. And Charles, are you here, and is that something that you can answer?
So unfortunately, I am still here. That question has come up quite a bit, and at this point, it's still a state decision as far as property taxes. I think, as most people are aware nowadays, that are aware that the majority of property taxes actually go to the state to do things like local schools and stuff like that. But the local tax collector has very little authority as far as pushing out that date. There's been a lot of talk across the state to address it, and I can see that there's a letter up on the screen right now from Mary Zeeb, your treasurer tax collector, that points out that they have the power. Like I said, there's been a lot of talk across the state about this issue, and it really will be up to the state to decide whether they're going to push out that date.
Thank you. A question has arisen about what protections are being taken to as far as healthcare workers and farm workers. Are there any special provisions being made?
So Go ahead also if you have anything, but I would just start out that there has been a lot of talk about the farm workers in particular and how to make sure that all the social distancing and that criteria is in place. I know that between the health department and the agricultural commissioner's office, they've been working on that, and they've been working together with the various farm organizations, the grower shippers, Farm Bureau, vintners and growers. All those organizations have been coming together to try and get the message out about the best ways to protect the agriculture workers, because as everybody is aware at this time, obviously having a stable food supply is critical to obviously Monterey County, but the world. And we here in Monterey County help feed the world, so we want to make sure that our workers are protected. Healthcare workers, the same thing. They're on the front lines, and it's really challenging. We understand that. I know that the leadership at the hospitals, the 4 hospitals, are aware of some of the challenges associated with making sure that the healthcare workers, both at your clinics, at your doctor's office, and then in the hospitals and hospitals themselves, have all the protective equipment that they need. I know that there's been challenges with that, and they're trying to make sure that that we have enough going forward, and they are on all the different sites to buy additional equipment, and they have those orders in. My understanding is that they're making sure that the equipment is there for the necessary times when it's needed. I know that there have been calls out to other organizations that might have equipment, masks and gowns, to try and get those to be donated, and that's really appreciated. And there's also a big effort to try to ramp up manufacturing. We've been in contact with different organizations, different counties that may have manufacturing abilities to address getting additional PPE equipment here. So it is something that's a topic of consideration, and something that is watched closely by the suppliers that work in the industry and that work for the hospitals, and also the management of the hospitals.
Thank you, Charles. And I think I have been reminded that the question actually was about first responders, which would include law enforcement and fire. And I don't know that the answer would change too much. I
don't think it would change a lot. I know Elsa and her staff who work with the EMS system. They have been making sure, pushing out at least for the EMS and fire, making sure that they have the supplies that they need. It's a challenge, there's no doubt about it, and they are trying to get all those supplies out that they can.
And of course, we're not the only area that is confronting these issues, so it's really tricky to be able to find the supplies that we need, because everyone else needs them too.
Right. So, and I think the key there is making sure that that you have they're wearing it when it's needed.
Mm-hmm.
Right. Elsa, did you want to chime in?
No, I was just going to echo that there's revised guidelines constantly by CDC and our California Department of Public Health for frontline workers, including first responders, et cetera. And so I know that in speaking with our sheriff, the direction has been to the deputies that they treat every home that they come into as if somebody with COVID-19 lived in that home, meaning that they're wearing gloves and other proper PPE, that they keep their social distancing. And I know that that's kind of a message that's being echoed across all of our law enforcement agencies throughout the county.
Great, thank you. There's a question about whether someone who tests positive for coronavirus who also has dementia would be denied ICU care. I'm not quite sure where that comes from, but is there an answer? I mean, I can imagine the beginnings of an answer, but we'll let you take that one, Elsa.
I will try and might have to get back my understanding is that there are very specific protocols to be followed with respect to who can get tested. And then obviously if somebody needs hospitalization, then they would be hospitalized. I understand then if somebody is with dementia and may tend to wander, that there are other precautions that would have to take place at the hospital if they were to be hospitalized. I know that we've been having discussions in terms of congregate living situations and what our plans are if we are to have a positive case and then close contacts within that. I don't think we have a definitive plan yet, but I know that we've been discussing with our local SNFs and others in terms of actions that would need to take place if there were to be a positive case in that type of situation.
Thank you. And a SNF is a skilled nursing facility.
Oh, sorry, skilled nursing facility, sorry.
A question about what criteria, what measurement would be used to lift the shelter-in-place order? I like this plan ahead.
So as Charles indicated earlier, our county health officer issued his shelter-in-place order before the state health officer did, or before the governor issued their executive order. Our initial version of the officer order was to terminate April 8th. When the state health officer and governor issued their order, there is no end date. And so we've revised ours to not have an end date. And we will follow guidance from the state with respect to if there is to be termination notice indicated on our order. Because our cases are increasing dramatically every day across the state, and some counties are having a greater case increase. And really we're attributing that to the fact that individuals are not heeding their local health officer order that may have been issued prior to the state health officer, or the state health officer's order now with respect to sheltering in place. And so because people are still congregating, socializing with individuals outside of their own personal household, we're continuing to see an increase in community spread. So until we abide by that shelter-in-place order and really stay home, at some point there might be a revisit of the essential services that have been provided by our governor and our state health officer, and there might have to be further restrictions to that. It's really a matter of we need to shelter in place to make sure that we can kind of get a handle on and prevent the further spread of COVID-19 in our communities.
Thank you, Elsa. There's a question about what the virus situation is in the jail and in the prisons within Monterey County. And the concern stems partly just from a general concern, but also specifically court personnel who might come into contact with people who are incarcerated.
So I don't know if Charles or Nick have more of a response, but you will see on our website, and I know that Wendy's trying to go there, scroll down. Our sheriff implemented, I think it was last week here, March 18th, they've suspended jail visitations, again, trying to prevent individuals that are not already part of that environment from coming into that environment. I don't know what's happening with the courts. I know that the court calendar is reduced dramatically, and they're trying to push out things and only have critical matters heard, again, to try to abide by the health officer order and assure that we're meeting social distancing guidelines. I don't know if there's something.
So what I can add to that is you know, we don't have any indication at this point that there are any cases in the jail or the prisons, and both the jail and the prisons are trying to take every measure possible, because as you can imagine, that would be a bad and scary place to have a virus like this spread. The courts have worked with the district attorney and the public defender and the private defense bar to only have those cases on that where the person has what's called not waived time, and there's an urgency to hearing the matter. And the courts have also pushed out through the sheriff's office an expansion of releasing people on their own recognizance, so that we don't have more people adding to the jail population. Recognizing that we are better off at this point to limit the number of people going into the jail, and the sheriff's been working with the courts on that issue. So it's a multi-pronged process to address the criminal justice system as well as the courts, and the courts have also they've also pushed out and continued all civil matters. So civil matters are not going to court unless there's some urgency to the matter. They are continuing to handle domestic violence and restraining order cases as well as urgent criminal matters.
Thank you, Charles. Yeah, and I think in the period we're in right now, it's a reminder that those that the precautions such as washing hands, using sanitizer, keeping 6 foot distance is really critical, because we don't have any people who have shown signs of the virus or who have been tested or are positive, but we're still in the incubation period. So that's true in the jail and the prisons as well as in the broader community. So again, a really important reminder to abide as strictly as possible by the guidance to shelter in place and maintain those kinds of safety precautions. Let's see, there was a question. I think we have time for 1 or 2 more. Could you talk about what planning is going into additional hospital beds should they be needed?
So, Charles, do you want me to start?
Please.
So the health department meets regularly with our 4 area hospitals to address, PPE needs, screening, testing, mobile testing, etc. So this is obviously another hot topic in that group. My understanding is that many of our hospitals have already implemented a practice of rescheduling appointments for surgeries that are not critical to that individual's current health status, pushing those out so that we have that bed capacity. And I understand that 2 of our area hospitals are really looking at wings they have within their facility. If they're being utilized for a specific population, maybe redirecting those beds to serve as surge for COVID-19 cases that need to be hospitalized. And another hospital is looking at a wing that they're not currently utilizing and doing what it takes to kind of get that wing up and running so that there's additional capacity within that hospital to house COVID-19 patients that need hospitalization. Additionally, we're looking at, through our EOC, looking at establishing alternative sites, meaning trying to work with the state in securing leases with area hospitals and motels to be able to provide capacity to house individuals that don't necessarily need to be hospitalized, but don't have another safe place to go. And there's also conversations about setting up tents or other types of structures at the Monterey Fairgrounds as an example. And these are efforts that we're planning in partnership with the state.
Thank you very much, Elsa. I noticed there's one more question about whether this has been being recorded, and we are trying to record it, and if we have been successful, we will post that so that this information can be available to more people in the community if they weren't able to be on this call. I also, so I want to kind of wrap things up. I want to thank Charles McKee, who is our Chief Administrative Officer for the county, for his participation, Elsa Jimenez, who is our Director of Health, and also Gerry Malais and Kelsey Scanlin from the Office of Emergency Services. They have been working so hard to get everything in place and get the information out to the community, and we really appreciate them being on this in this meeting and in this forum to allow people to hear from us all a little bit more directly. I think that's it is very helpful for people to be able to ask specific, more specific questions, hear the answers from the folks who know. And I also want to encourage people to sign up for the Parker Report. We will be sending out email updates on the COVID virus as frequently as we feel it's necessary. And so I just want to thank all of you for participating and being part of helping to get the information out further into the community. And feel free to email my office or call my office with other questions you may have. We will get those answered for you as promptly as we can. Thanks so much, everyone. Have a good evening and stay safe, and we'll see you from a safe distance as you're out taking your walks.
Thank you.
Thank you.
Thank you.
Good job, Wendy.
Bye, Wendy.
Oh.
Okay, hold on. I gotta stop our recording. We're gonna end our recording. Stop, yes. Thank you.